As a full spectrum doula, my personal focus is prenatal information and
Mm-hmm.
education, then guidance through the actual birth process,
Mm-hmm.
and then postpartum care, depending on what a family's need is.
Mm-hmm.
Um, I know one of the projects is that first, your fourth trimester,
Mm-hmm.
and how important that time period is.
Mm-hmm.
But if I'm going to go from education through, I actually got permission from one of my families to speak about them.
Okay.
And I actually ended up doing their care virtually. This whole
Mm-hmm.
pandemic has made
Mm-hmm.
things a lot harder. You have to be a little creative to navigate some of these things. And this family doesn't even live in the same state as me.
Mm-hmm.
And they really wanted that advocacy and that education and care
Mm-hmm.
throughout their first baby together.
Mm-hmm.
And super sweet couple. Oh my goodness, they're so sweet. The father has had a child before, but he's
Mm-hmm.
grown.
Mm-hmm.
And this is mom's first baby.
Mm-hmm.
And so we started off with really just kind of what to expect
Mm-hmm.
with pregnancy, things to look at their where they're being provided for, what their comforts, discomforts were, what the things that they had in their mind. Because a lot of times when you go to a couple or you go to a birthing person, they
Mm-hmm.
already have some preconceived,
Mm-hmm.
like, okay,
Mm-hmm.
I'm either fearful, anxious, concern, those things. So you want to talk about those things from the get go and try to give them the resources to alleviate what we can alleviate.
Mm-hmm.
And sometimes that comes down to picking a provider.
Mm-hmm.
Um, it's amazing how many people don't know that they can actually pick
Mm.
their provider. They're not necessarily at the mercy of the person who says,
Mm.
"Oh, this is who you're going to see today."
Mm-hmm.